So now, after you've completed the first observation for the pre-operative therapy for the patient and gathering or charting down the results, you move on to the post-operative therapy, which you basically use the same equipment. The only thing that you would different that you would use in the post-operative is the stethoscope. Um, and then you basically do the same thing, kind of like the pre. You'll wash your hands, take safe precautions, or isolation procedures, and then introduce yourself in the department and explain to the patient what you're doing and the purpose of it, and then confirm too also as well. Then after that, let me backtrack. So, like I said in the beginning, the purpose of the incentive spirometry therapy is to increase the transpulmonary pressure and inspiratory volumes to reestablish um, normal patterns of deep breathing. And then, so after that, um, you'll measure the patient's post-operative inspiratory capacity and vital capacities. And this time, the patient should they should be shooting for they should be the inspiratory their capacity should be different. It should be decreased, a decreased effort for the post operative. And like I said, pretty much doing the same thing as the pre-operative. You assemble the device, um, assess the patient's progress, whether that be pain medication schedule, chest X-ray reports from the chart, the patient's pulse and respiratory rate and breath sounds on the auscultation. And then after that, you will re-instruct the patient on the use and frequency of the incentive spirometry device, and assist the patient using a pillow to splint the incision to minimize pain during the therapy. Um, and then after you've done that, have the patient demonstrate the procedure. Normally for this therapy, you want to shoot for a 80% or greater. That's good. That's where you want to be. 79 to 70 is mild, and then 69 to 60 is moderate, and then 59 to 50 would be moderate but severely, and then anything lower than that is like you gotta it's real bad. um and then, like I said, for this procedure, you want to have the patient demonstrate the procedure to you, and measure the achieved volume. Like I said, 80% or greater. That's what you're shooting for. For the volume-based device, you can observe the maximum inspiratory effort achieved, and then it can also be measured by using a respirometer. And then what you would do with that is attach it to the incentive spirometer, the respirometer, and then instruct the patient to cough. And then normally, what the respiratory therapists are looking for is an observant of sputum production, and then you want to auscultate the patient And so within the sputum production, you're looking for like the colorization, how like thick is it, just anything that seems abnormal in like the sputum. And then, like I said, you want to auscultate the patient after that as well to make sure their breathing is normal. Like I said in the beginning, the purpose of this therapy is to reestablish a normal pattern of deep breathing. So you want to make sure that's normal. They deep breathing, and then you want to chart it down as well.